the Gates Foundation has called on African journalists to take a leading role in sustaining progress towards the elimination of neglected tropical diseases, NTDs. The call was made at the 2025 Remembrance Media Forum and Awards held in Benin. The event, which coincided with the commemoration of this year's World NTD Day, took journalists from across Africa on a field visit to a treatment center for people suffering from leprosy and Broly ulcer at the Royal Referral Foundation in Pobe. Emefa Atiamo Eli has more in the following report.
Neglected tropical diseases continue to affect more than 1 billion people worldwide, most of them living in Africa. Though preventable and treatable, these diseases continue to deepen poverty, disrupt education, and undermine livelihoods in vulnerable communities. Speaking at the opening of the 2025 Remembrance Media Forum in Benin, the Deputy Director of Advocacy and Communication Program in Africa at the Gates Foundation, Toko Elfik Pule, said the foundation is proud to support Remembrance's work in strengthening journalist capacity and promoting evidence-based, human-centered reporting on neglected tropical disease.
Media professionals play a direct role in the success of efforts to combat neglected tropical diseases. Eliminating these diseases is not only a public health imperative, it is also a matter of social justice, equity, and human dignity. No country, no community, and no child should be left behind in the face of diseases we have the tools to defeat.
The World Health Organization, also at the forum, reaffirmed its commitment to working with African governments, partners and media networks to make elimination of neglected tropical diseases a reality. Dr. Konan Jin is the Benin office country representative.
It is a key issue for us to have journalists on board, because without journalists we cannot win this fight against NTDs. It's the good way for me to thank Remembrance's for the good work they are doing in Africa.
In a symbolic commemoration of the World NTD Day, the Remembrances Network visited the Royal Referral Foundation Center in Pobe, Benin. The journalists drawn from all over Africa witnessed firsthand the conditions of people living with leprosy and Broly ulcer that still carry stigma and long-term social consequences. Oswald Atulo is the director of the Royal Referral Foundation Center in Pobe in Benin.
Le bébé, je vais dire directement, le plus petit qu'on a reçu,
the baby we received was 4 months old. He began developing bruises around the hip, which later worsened. When the mother brought him, the foot was almost gone and lifeless. Eventually, the father abandoned them. The child was hospitalized for 11 months because he was malnourished. It was beyond our expectation. The oldest patient is 92 years old.
Finalement, le papa les a abandonnés.
As part of efforts to eliminate neglected tropical diseases, stakeholders at the ceremony say the media's role in telling these stories remain critical to sustaining momentum and ensuring no community is left behind.